Welcome to Pulse and Pressors, where critical care gets crystal clear. In this session, we review dexmedetomidine, a selective alpha-2 adrenergic agonist that redefines sedation, preserving wakefulness, respiratory drive, and physiologic precision. Dexmedetomidine stimulates central presynaptic alpha-2 receptors, primarily in the locus coeruleus, reducing norepinephrine release. This blunts sympathetic tone and produces sedation that mimics natural sleep, maintaining arousability and spontaneous ventilation. Dexmedetomidine begins acting within 10 minutes, with a 2 to 3 hour elimination half-life. It's water-based, not a lipid emulsion, meaning it contributes no fat load and requires no triglyceride monitoring. Its context-sensitive half-time increases with prolonged use, but remains manageable compared with propofol or benzodiazepines. Start at 0.2 micrograms per kilogram per hour and titrate to the desired sedation target, usually RAS-1 to 0. Avoid loading doses in hemodynamically unstable patients. Peripheral alpha-2b stimulation can cause transient severe hypertension before central sympatholysis occurs. Dexmedetomidine often produces an early hypertensive response, followed by hypotension and bradycardia. This biphasic pattern reflects initial peripheral vasoconstriction, then dominant central sympatholysis. Dexmedetomidine is approved for ICU sedation up to 24 hours, but is often used longer. It's ideal for light, cooperative sedation, promoting ventilator synchrony, extubation readiness, and lower delirium incidence. Dexmedetomidine provides a calm, arousable sedation without blunting respiratory drive. It reduces delirium, lowers sympathetic output, and modestly decreases analgesic requirements, particularly valuable in cardiac and neuro-ICUs. In post-CABG care, dexmedetomidine stabilizes sympathetic tone and reduces postoperative tachyarrhythmias. It supports early extubation protocols and lowers both delirium and opioid burden. Dexmedetomidine helps control autonomic hyperactivity in alcohol withdrawal, but doesn't correct the GABA deficit. Use it as an adjunct for refractory symptoms, not as monotherapy in severe or complicated withdrawal. Dexmedetomidine is suited for cases requiring sedation without respiratory compromise, ventilator weaning, proning, or neuroexams. It reduces metabolic and sympathetic stress while preserving perfusion. Avoid dexmedetomidine in patients with significant bradycardia, AV block, or hypotensive shock. Dose reduce in hepatic impairment. Prolonged use has rarely been associated with drug-induced fever, a key diagnosis of exclusion in ICU's hyperthermia. Ensure adequate preload before initiation. Dexmedetomidine's sympatholysis can benefit stable low EF patients by reducing afterload, but in acute heart failure or hypoperfusion, it may precipitate severe hypotension. Be cautious with concurrent beta blockers or amiodarone, which can potentiate bradycardia. Taper slowly after prolonged use to prevent rebound hypertension or withdrawal agitation. Most adverse effects are predictable and dose-related, primarily bradycardia and hypotension. Clinicians should also monitor for drug-related hyperthermia, a rare but important diagnosis of exclusion in febrile ICU patients. With prolonged use, abrupt discontinuation can trigger dexmedetomidine withdrawal syndrome, presenting as rebound hypertension, tachycardia, or agitation. Compared with other sedatives, dexmedetomidine uniquely preserves spontaneous ventilation and lowers delirium risk. Its aqueous formulation avoids the lipid load and triglyceride monitoring required with propofol, an important practical advantage in prolonged ICU use. Initiate dexmedetomidine at a low rate and titrate with close hemodynamic observation. For long infusions, taper slowly to prevent withdrawal and rebound sympathetic activation. Oral clonidine may serve as a bridge during weaning to maintain alpha-2 tone. Dexmedetomidine achieves sedation with preserved physiologic control, clarity without compromise. It's a cornerstone for ICU calm, useful in extubation, alcohol withdrawal, and post-cardiac surgery recovery, provided volume and rhythm are stable. This is Pulse and Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.